Hi, my name is Eloise Sepeda, and I am the Senior Manager of Mission Capital Collective Impact Child Welfare Portfolio, and I am a BIPOC, child adult survivor leader of family domestic violence, sexual assault, and poverty leading to homelessness, gangs, and navigating multi systems. We at Mission Capital have been a nonprofit for over 20 years. The mission is to equip and connect mission-driven leaders, organizations, and networks to advance equity and opportunities through their work. My partner is Tanya Rollins, who is a sole proprietor of Inspiring Voices Equity and Inclusion LLC and the co-founder of the Child Welfare Race Equity Collaborative alongside Judge Martinez Jones. The mission of CREC, also known as Child Welfare Race Equity Collaborative, is to confront and acknowledge the racial disparities in our community by building awareness, providing education, advocacy, and holding systems accountable, with the vision of assuring anti racist work to end institutional policies and practices that result in disproportionate outcomes for Black children. From 2019 to 2022, BIPOC representation has grown within Mission Capital at every level of the organization. Among staff, it more than doubled from 31% to 64%. The leadership team is four times as diverse today than it was in 2019. That was a huge jump from 14% to 60%, and BIPOC board representation has soared from 31% to 77%. Tanya Rollins identifies as a Black woman healing from racial and institutional trauma. She's retired from CPS after 30 years and is pursuing a PhD in social work with the research focused on inequities within the child welfare system. All of the core members of Child Welfare Race Equity Collaborative, also known as CREC, are persons of color. We are centered CREC is centered around the needs of the BIPOC community so that we may dismantle the systems of oppression leading to disparate outcomes of the BIPOC community. We've made tremendous efforts to undo white supremacy structures of business to become the culturally specific organization that we are today and still have so much more work to do with your support. Mission Capital Collective Impact Child Welfare Team, our team, has hired 90% BIPOC grassroots leaders, community, parents, caregivers, and youth to close racial leadership gaps, increase resilience and sustainability, and to expand and strengthen the capacity of collaborative networks. Our peer learning training has shifted from 2021 at a 1% BIPOC engagement to 56% BIPOC identified community or audience engagement within 1 year. We have also created a strategy committee within the last year that consists of 79% BIPOC members. Tanya Rollins and Judge Martinez Jones and myself are all BIPOC members of WTF, Women Transforming Families. Through our collaboration with Travis County Model Court and Texas Women Working at the Intersection for Safe Families, which is also known as T-Ways, which was a state cohort launched from the national WTF cohort, aims to provide brave spaces for survivors of domestic violence, as well as provide avenues for healing through advocacy. We consistently monitor and respond to local and state data to address the impact on Black survivors, children, and their families of domestic violence and sexual assault. We offer education and training, access to resources, safety planning, referral support, opportunities of engagement. We believe that people most impacted by the harm should be at the table and have a voice. And as a survivor, I know how difficult it is to receive a letter with a list of numbers to call. And so we really tried to help bridge that gap. Tanya's is works really, really hard at the approach to serving Black community and Black victims of survivors through the Child Welfare Race Equity Collaborative by using a racial justice lens. We have collaborated to form parent advisory councils, conduct zip code specific community gatherings in communities who have been marginalized and identified with the highest reporting for domestic violence and child welfare. Through ongoing discussions of racial trauma and the use of anti racist principles, we aim to provide services that center the voices of BIPOC community. We will use this funding to increase health equity by targeting our advocacy efforts to reach health care providers who are currently one of the top 3 reporters of domestic violence and child welfare. I currently serve on the Central Health Equity Policy Council, where we are creating tools for healthcare providers to improve data collection, leading to policy change within healthcare practices. We're also working in partnership with Judge Martinez Jones to bridge opportunities for BIPOC mental health providers to provide education and bridge the gaps to help better understand the impacts and stressors of trauma on children and survivors of domestic violence and the re traumatization caused by traditional systemic approaches. One example of the partnership that we have engaged and supported in with Black community leadership is in summer of 2021. We launched a project with youth alumni and youth in care to develop a tool to assess what it's like to be a child of color in care, and that highlighted specific needs of Black youth in care. This led to strategic responses, education, and awareness, and then the youth were invited to participate in a White House discussion regarding youth in care. Judge Martinez Jones, Tanya Rollins, and I all have worked closely together and alongside our WTF and T-Ways cohorts to disrupt systemic racism, raise awareness, provide education, and not just reimagine but reinvent systems of holistic support, such as healing centered engagement. Families should be able to choose what healing looks like and feels like to them. The CREC transformative approach to assure every child has a safe and permanent healthy home and to be culturally responsive in supporting families while ensuring systemic equity for both children and parents through initiatives that address race equity, domestic violence, pregnant and parenting youth, and LGBTQIA plus youth. Our Travis County Child Welfare Reimagined pilot is culturally responsive and focuses on equitable approaches to supporting families at the interest at the intersection of domestic violence, substance abuse, mental health, as well as implementing strategic partnerships between families, communities, and court systems. What moves us? What drives us? Data drives our strategic work, providing education and awareness for local, state, and national and international multidisciplinary providers on the inequities of child welfare and domestic violence. And lastly, advocacy through our community gatherings, which decenter hierarchies and center the voices of BIPOC communities. We aim to provide vehicles for healing through healing centered engagement. We thank you for your consideration and for your future support to help us to improve and to dismantle racism within our city, county, and state, and to provide the support and resources that families who and children who have encountered domestic violence and the intersections that come with that. We thank you for your time and your consideration.